Okay, so let's call to order the work session of the Cochise County Board of Supervisors to discuss the jail district budget. Pursuant to ARS 38431.02, the public will have physical access to the meeting room 15 minutes prior. Any item on this agenda is open for discussion. Members of the Board of Supervisors will attend in person or via Microsoft Teams. Members of the public may also attend this meeting via Microsoft Teams or the mobile app. Work sessions are a time for county staff to form and discuss agenda items with the Board of Supervisors, and public comments will not be taken. We'll do a roll call vote. District 1, District 2,
Gomez is here.
District 3, Antonori is here. All supervisors are present and in person. We'll begin with an introduction by Ms. Gilman on the discussion on the jail district budget.
Thank you, Mr. Chair. So the jail district budget, of course, is where we are proceeding as if all things remain the same, since we don't have any formal action on anything different yet. So I've asked Jan Broadhoff from the jail to provide us with an explanation as to their budget requests as the jail district currently stands.
So anywhere that are, depending on legal decisions and what happens, obviously, we can just substitute general fund for district depending on what happens in the court. Just like the sheriff talked about, we have many of the same challenges. We're in the same office. Fentanyl impacts with inmates. We are currently changing our policy on mail, where we're going to photocopy all the mail and give the photocopy to the inmates, and it's going to cut down a lot of the introduction to Suboxone and a lot of those microsynthetics that are coming in through the mail.
In the paper?
Oh, in the paper, underneath where the kids color on the kindergarten picture, in the envelope, in the adhesive, in the bindings, yeah, everywhere. So I think that's going to really help that fentanyl issue that we're having in the jail. Mental health obviously continues to be a huge issue. Obviously, you guys all know that the largest mental health institution.
What is the dollar impact for that right there?
For just mental health?
Just the mental health. How about the, let me clarify.
Okay.
The non-violent mental health, the people that you take in related to drug and substance abuse that are there because of substance abuse or because they just have a psychotic episode and they're placed there for protection, or they're threatening suicide, or they're threatening to hurt other members of their family, but they haven't done anything yet. What is that?
Mr. Chair, we don't have an exact number in front of me, but I can work with Megan and we can narrow that down for you. I know a year and a half ago, we took a snapshot of the population on one day, and 66% of the population that day had at one time in their life been treated for mental health issues.
But were they in the jail for mental health issues?
No. So
Okay, well, that's what we're trying to find out. So this is why Ms. Gomez has got her hand up, because we're on the same sheet of music here. We're trying to offload that from you guys.
Yes.
Right.
With a mental health facility in Douglas, to take some of that non-violent, non-criminal mental health stuff out of the jail.
And the sheriff's office has started to work on that with our care team.
Yeah.
So, it used to be that, when the sheriff was called to Circle K for the 5th time in 3 hours, because the guy's standing there cussing everybody out,
Right.
coming in and out, that he had no choice. He just brought him to jail.
Right.
Charged him with trespassing or whatever the case may be, just to get him off the street. Now we have that care team that can intervene, but at a certain point, they still got to come to jail, even though they've committed a crime, because our alternatives are take them to Tucson,
Right.
take them to Phoenix.
Right.
If we had something in Douglas, we've been advocating for a crisis center for a long, long time. And I give the same speech all the time about a crisis center. It's two sides.
Right.
One side is beds, because some people need about 72 hours to see a professional, get back on a medication. But the other side is chairs. So sometimes you just need to sit down, have a peanut butter jelly sandwich, watch a couple episodes of Gilligan's Island. You're good to go back out again.
Yeah. So what we're getting at is we're looking for an offset for potentially funding a facility, or to make a business case for the company that we're talking to that may want to put that facility down there. So
Have a psych ward, a real psych ward.
it'll be voluntary and involuntary detainment in a facility and whatnot, but it won't be a jail.
Right. And that would really help with our Title 36 issues.
Yeah, and then there's other federal funds that are coming down through Medicare and Medicaid that are able to be obtained through, like, this company that we were talking to that that does that they can tap into. We're trying to help with the business case.
I am looking forward to that.
Yeah, we just want to get an idea.
So, Mr. Chair, you want to hit Rule 11 for a minute? Rule 11 is you're incompetent to stand trial. So that falls under us, under jail. So somebody's ruled by a judge saying, hey, these are Rule 11.
So
Diagnosis.
if he said that he's incapable of,
We can't just let him
He can't-
loose because he's still a risk to
Right.
society.
But we have to send him for an evaluation, and then the judge, in concert with medical professionals, decide if he's competent to assist in his own defense. So that's where a big cost on the
Yeah.
county is. So right now, we're paying Pima County like $36,000 whether they stay a day or whether they stay a year in order to try and
Is that per person?
that's per person.
Yes.
But if we send them to the Arizona State Hospital, it's $100,000 whether they stay a day and then call me and say he's good to go, come pick him up.
What a
Or
market
if they
racket
stay
that
in-
is.
That's per
Per
person.
person.
Yeah.
And the county attorney's office also pays that. So that comes out of their budget, but so you'll hear about that in their budget request as well, their
And-
budget work session.
And let me understand it from when I was talking to some people in Pima, they go, yeah, you guys need to do something because then we just release them on the street. We don't necessarily, or do you?
No,
provide them?
we have to provide that.
So you do have to bring them back.
Security, yes.
So then I guess
the ones
another
that are,
price.
they're, Rule 11 are currently facing some charges.
Okay.
So they're trying to say that, their lawyers are saying that they're not competent to defend themselves in a trial.
But if somebody is just like a little bit crazy and standing and cussing somebody out all the time and then get tired, and then they have to be assessed because maybe they could be dangerous, then you take them to Tucson, right? And there you're not necessarily
Then they can be released.
on the street. So you have two issues there in
Yeah.
our community.
Right.
All right, I didn't mean to derail your
Yeah.
thing. I was just trying to get a rough idea of what that might be, and we'll figure that out.
That would be something I'd like to talk to you guys about because in building this case, to do this is important. I think that we could help you with the cost, be a good case why we need to
Well,
have
it's going to help the taxpayers because they're not paying 36 grand or 100 grand.
100,000 per person.
Yeah.
The Yavapai County business has probably one of the best mental health programs that you will find when it comes to keeping them out of jail and keeping them into that center you're talking about. If you mirror what they're doing, there's funding by the state to do that. We just don't have we're so buried with just trying to keep jail. So, but that, if you guys get a chance, we'll set that tour up for you. You'd be very impressed.
Yeah,
Very
that's
impressed.
good.
So those are our challenges, much like, the sheriff talked about the consumer price index and then marketplace competitiveness. We're asking for the same thing that the rest of the office is asking for, $2,400 increase for detention officers, $1,200 increase for corporals, sergeants, and lieutenants, medical staff, $1,200, administrative staff, $1,200. So that would total all salary increases, $213,938.
So the medical administrative staff is going to be based on the market analysis that we got to do later, right?
Typically, we would include them in that. If you would like to do the funding with us, we can talk about alternative ways.
But I mean, we're going to sit down and evaluate for all county employees the generic cost of living market increase that's going to, so what I was talking about was separate salary increase for line deputies like sergeants, corporals, and whatnot, plus the corrections officers, right? Not counting all the administrative or
So you're saying doing looking at what our market adjustments would need to be countywide, and then in addition for just deputies and detention officers,
to get them to
an additional.
3%. That's what I'm saying. So it's probably going to be like 1.6% or somewhere in there. I'm just guessing. Don't hold me to that. But let's just say it's a countywide 1.6%, and then to get the deputies to 3, we got to give them another 1.4 on top of that. I'm just trying to get an idea what that is.
We'll know more once we get the market.
Yeah, that's right. Once we know what that is, whatever that is, whatever the delta would be, that's the increase above that for the deputies and the corrections officers. That's what I'm getting at.
Factoring in steps.
Yeah.
Too.
Well, that automatically Matches your, we'll put that, yeah, we got
Give
to.
it that.
Yeah, so that's all. But I'm just looking at where he's got medical staff, administrative staff. That number will come from likely whatever the determination is
Of the market.
of the market.
And as they're part of the sheriff's office, as everybody else, we wanted the same proposal for everybody that's in the sheriff's office, whether they're, medical, whether they're a secretary, whether they're an admin assistant, whether they're an evidence custodian, whatever the case may be, if we can give each one of them.
We'll look at it.
And that's right, and that's part of that comparison with the sheriff.
Yeah, but
between a percentage and a fixed rate. So we're
Yeah.
just continuing to ask for the fixed rate like the sheriff did.
Probably gonna do percentage.
Um,
Just saying.
So it brings us to our first request, which is, after the salary, which is part-time funding. We talked about this last week when I was here, is that we were given 30 part-time positions to use through the jail to save with overtime because they're a lot cheaper and they don't have ERE. But there was only funded at $12,000 for 30 positions, which we never did. So it's just a matter of when they work. So we're asking for $40,000 to cut down on that overtime, and we think that we can offset that cost through not spending overtime by utilizing part-time officers.
Well, hang on a second. So help me out on the PSRS.
Where do you recruit part-time?
Yeah, hang on a second. So the PSRS is only based on their full-time
Detention officers are court.
corp. Okay, they're corp. Yeah, that's right. They're corp. So
So
they're,
unlike PSPRS.
so those guys, a lot of those guys are on the 401k.
Right.
now.
Since 2018.
Right. So overtime, trying to,
Overtime for corp was never, ever included in.
well, that's what I'm trying to get. I probably have to get with Stacy on this one too. So I'm looking at the total cost.
Hmm.
It is probably cheaper to do overtime
We can figure it out. We can do some math.
on corp than it is to hire a new body. Because if you hire a new body, then you have a match, you have the 401k, you have the health benefits.
There's no ERE.
On the part-time, there's no ERE.
There isn't?
No.
We get them on,
Part-time temp.
we get them from
So
Department of
they're.
Corrections.
So you just salary? That's it? They get no other benefit.
And it's hourly. So depending, they can work anywhere from 1 hour of pay period to 19 and a half hours a week.
So then it is cheaper than overtime because you're not paying them time and a half for
Correct.
Plus
double time.
And I'm not burning all these people out that are working 12-hour shifts out there.
Okay. That's what I was trying to understand. And that's,
You're using a Department of Corrections employee that may be working 40 hours in addition to the overtime that you're offering.
Sometimes. But a lot of people are retired, or we even have a couple that have left our office.
and are retired and just come back.
And they're.
So they're double dipping, but they're not
But
eating
it's
our budget by hitting our,
I'm in favor of that. I mean,
yeah, that's all.
is the personnel being in jail.
Right.
And
Yeah, and I just don't want to,
burn out with that.
yeah, I didn't want to add additional benefit costs by hiring part-time employees, but if we're not, if that's the case, that sounds like a great
Yeah,
idea.
that was a very
Worked
smart.
well. Yeah. All right.
And the only other requests are from Megan, and she can go over a couple of those. There is one that I want to talk about that's on the summary sheet. $12,000, it says increase for nurse practitioner salary was covered by IWF fund in the past. So what happened was we used $12,000 out of the inmate welfare fund to subsidize our provider at the jail. So the FCC recently came out with new regulations where we can't collect any commission on phone calls and video visitation. So that fund is quickly going away. So we would like to move that $12,000 into the district or the general fund, whatever the case may be. Because we don't have an alternative funding source for that.
So there's a cost that you gotta make up for inmates to use it.
Yeah, so
We lost that one.
so for years and years and years, no matter what company any jail or prison was with, you would collect a commission off of phone calls and video visit because they charged,
Yeah.
and that has gone away effective April 1st. So
That was a federal,
that was and we're hoping it gets reversed under the new administration. The president has appointed some different people on the FCC now, but as of right now, It's done. We're currently renegotiating.
You're making 12K a year off of
We
that?
were making more than that.
Mhm.
Yeah. The only other funding source that helps that budget line is revenue from commissary sales. And that's not enough to maintain that $12,000 for that medical provider. Megan?
Can you guys hear me okay from over here?
Yeah, come on over here so the people online can hear you on the microphone.
Good morning.
Microphone. It's like a mouse.
So, Detention Health Services is requesting a total of $23,000 increase across the board with our budget. 5,000 of that is specific for operating supplies. Those operating supplies we have an increase due to the increase in the state of the economy, also the influx of resource-intensive inmates that we have, just a lot of high risk and largely unhealthy population. Our professional services line, we are requesting an increase of $5,000 as well. This line is where we fund our contracted nursing staff. So we currently have 2 vacant positions in detention health services that we've had quite a difficult time in hiring for. We have minimal applicants interviewed, and they've either not followed through with the background investigation or have accepted positions elsewhere for higher rates and pay. The hiring and somehow fell through during the hiring process.
Is that because they're in the closet?
It could be.
Right?
That definitely could be it. The other portion that we are requesting is $13,000 increase to the miscellaneous professional services. That portion will pay for the medical director, which we will split with the health department. It is a monthly bill that we receive, a monthly payment that we pay to have the medical director, and we will split that 50-50 with the health department.
So the medical director is a doctor who oversees the work.
Right.
The nurses.
So I just remember when I worked at Banner, University Medical Center, do you have any kind of agreement with one of the hospitals? You know, that they can, where you take the inmates if, you know, they're sicker, then that little closet can provide any kind of assistance to?
So we don't have specific agreements with hospitals. We do it on a case-by-case basis. There are multiple instances where we have to transport an individual out to the hospital and they're admitted. And when they're admitted, they are admitted to the facility that they're at. If they require long-term care and long-term intervention, a lot of times we'll work with Copper Queen, you know, and say, hey, you have a swing bed facility here. Can we house our inmate, or can we move our inmate to this location within your hospital so that we don't have to have our transport officers aren't going all the way to Tucson to stay on the inmate as well. Thanks for me.
So this 23K in here, is that in the 288K supplemental increase that you're asking for?
Yes. That's
Okay.
so on the summary slide there for the 288, that includes the medical director payment, half paid by health department, $23,000, $40,000 part-time, and the $12,000 increase for the nurse practitioner.
Okay, yeah. And some of the time, not to change the topic, because it's generally related. I'd like to sit down with you and kind of go over some efficiencies that we can put in the new jail.
Okay.
To try to reduce your manpower requirements. And, you know, again, Dave Gowan took me in. I got to go see the new prison, and I was kind of impressed with the technology and telemetry for inmate control and inmate movement and inmate management. I know it's a state prison. And
Which prison was that?
it's the one up in Florist, and the new one that got built up there. I went with him and the director last year over there to take a look at it. But, you know, efficiencies can save money without impacting safety or without impacting other issues with regard to size and infrastructure that's required. So going through and how you manage your inmates so I can better understand how that process works, and then sitting down with Phil and Chin to kind of lay that out so that we can kind of build a requirement for what we're looking at. She had a layout, and again, the layout up there is they have a wagon wheel spoke system.
Right.
She had a pod.
Well, that was more of a space presentation. That was just
Yeah.
sort of this is how much space it's going to take. It
Yeah,
wasn't necessarily-
I got you. But that's what I'm getting at, though.
Yeah.
It's just that I want to see the most efficient layout that we could build this thing to, and and then have that expandability potential too. So if we need to add another 100 inmates, we can build another inmate or another wing. Or if we want one wing is getting old and needs to be renovated, we can move guys over, put a new wing in, then go back and renovate, that kind of stuff. Mr. Crosby.
Are you and Madam Gomez exploring the possibility of having a mental health facility not co-located with any jail?
Yes. Yeah. We're talking about, so there's discussion with two companies that provide mental health services. One of them is associated with the hospital in Sierra Vista, that they all do mental health. And another one was I can't remember the name of the other company that we talked to. With.
And then I also talked to Yuma Regional, that has cycle.
So
It's really
they have to have a
interesting.
business case to justify. We have to show a patient population that is sufficient. But if we can show that, which it sounds like we have, right? And then there's other services that substance abuse for people don't encounter law enforcement yet, that are in the early stages of, let's just say, substance abuse, that they can offer services to, and they get Medicaid funding for that, and they get other federal funds for that. If they can get that business case, and we could build that in conjunction with a primary healthcare facility as a wing of that healthcare facility, is what we were discussing. So you would have a community hospital built, and then part of that community hospital would be a mental health wing, and that mental health wing will have both voluntary and involuntary detention capability, right? So that you would be able to offload these non-violent criminal guys that can go to a facility like that out of the jail, and then these guys would hold just the worst guys would stay at the jail.
Mr. Chair, yeah, and I know I brought up Yavapai. They have that reentry program. They have where, for example, like the peanut butter sandwich guy that the commander's talking about, where law enforcement doesn't take them to jail. They take them right to that center. They have a 5-minute drop, and they drop out of 1,000 people, they dropped it down to like 10 a year. That those 1,000 would have gone to jail, they're down to 10.
Yeah, that's exactly what we're looking at.
That's what I'm saying. They got
and they have all the stats.
Well, that's good. That's good. That's good. That'll help us because part of the discussion with these healthcare companies is that case there, and that model maybe in some way, shape, or form could be, maybe not all of it, but some of it can be adapted to what we're trying to do. But we're trying to kill two birds with one stone here, right?
Yeah.
We're trying to put a hospital in Douglas and the mental health facility to offload some of the stuff on the jail, but to also create a county-wide mental health care system, because other counties have mental health facilities and we don't.
And there's a lot of pushback, of course, with existing, like even Sierra Vista or Copper Queen, because they see it as competition, but they don't provide those services.
No.
And then when you're talking about an ER that can only keep somebody for 2 hours, that's not healthcare either. So.
And just so you know, for your benefit on this, Ms. Gomez, is the fact that Sierra Vista Canyon Vista, when they built that for the 4th floor, we were excited about that because we thought, okay, this is a good out. But then we're competing with the military
Right.
on that. But last but not least is they've changed their policies for insurance reasons and everything else. So if we have combated a mental health, they won't take them.
Yeah.
They will.
Yeah, that's why a separate wing that's an isolated wing with a yard and then, all that
I can
stuff.
keep them for if they need to be
Yeah.
there a week,
Yes.
2 weeks, or whatever.
Yeah,
You'll have our support 100%.
Yeah.
Yeah.
But the requirement for the jail to save costs, so, the manning requirements can be less, the way you manage and move your guys and setting that efficiency up. And we gotta sit down with Phil and Chin and kind of hammer that in, because, operational costs need to be at or below where you're at right now. I don't want to see a new jail and then have you come back and say, well, now that we got a new jail, I need 16 more corrections officers for this bigger fancier jail.
So you
It should be the opposite. It should be, now that I have this bigger, fancier, more technology jail, I only need this
So
many.
when Chin Planning, I've seen already the draft of the report that they're going to come and present to you in May. And the staffing plan is pretty outrageous. So just don't take that for.
I won't take it for face value because that's the whole point of it. The whole
Right,
point of it is,
I mean, it has things like receiving clerks and, stuff, people that work. at
Oh, I
the
got you.
warehouse, Stuff like that. We don't have that, and we can, I mean, there's a lot of that that's not going to be necessary.
and why would they put that in this report then if they know?
Is it gonna do the
They want to
most?
see the task and
Right.
the drive.
They want to see every issue with every, big jail that they've ever built, and those are the positions that they have. So if you build this jail, this is positions that they recommend.
So Sharon, do we have you know what Six Sigma is? You ever heard of that?
Mhm.
It's an efficiency. Do we have a guy? A
We
Six
don't.
Sigma guy? Does Chin have a Six Sigma guy?
I believe she has the certification. I think.
We need a Six Sigma guy. Or gal. No offense. Six Sigma person.
And
But-
this is just,
What happened?
the 100-mile view. It's just the 100-mile view.
no, I got
So,
you. But
as we go down.
Yeah.
100-mile view, 100-mile view, we need to be down to the 5-mile view because we need to start planning on building this thing next year.
Yes, we,
Right?
we don't
So-
need 10 locations, we
Yeah.
just need one.
So,
That does bring up a discussion point for the future, because I would like to have another work session with the board as Chin Planning wraps up their study as to next steps and how far you would like staff to go in contact.
critical to site selection. And they're going with site selection and looking at the footprint. I think that's back-asswards. I think it should be the other way around. I think you should write your requirement for a jail, design it with a specific layout in mind, and then find a location to put that. That's what we should be doing, based on the efficiencies that can be put in. That's my theory.
But they were giving they were giving a chunk of money and then just kind of told, right, do,
Yeah, I'm
There's a
not,
scope,
well, it seems like a huge scope.
it is, but it's a planning scope.
yeah, it's true.
It's all
But
just
I'm
planning, and then we
getting
move
at,
to design.
we need to draft and then, there's what they call a threshold requirement, which is the bare minimum to stay within some established standard, whatever that may be. And then there's the objective requirement, which is if I could, I would build or have this, there's two things. We've got to look at that. She's coming in with what I believe is the objective requirement. And what I'm talking about is the threshold requirement, which is the difference.
So that, she'll be back on May
Good.
5th,
Okay.
so
May 5th.
not too far.
Oh, crap. I'm not going to be here May 5th.
No,
No.
you have to be here, don't you?
No, that's Special Operations Industry Week in Tampa. I'll be down there with my,
They
You're going to
said-
go on May
May
6th?
yeah, it's May 5th through May 8th. I already told Mark.
Yeah.
She didn't pass that along, I guess. That's
I
okay.
have one other question.
Okay.
So when you're looking at, say, the fire alarm system in your existing jail, and
Cats away.
there's water suppression, right, but not an alarm?
Mhm.
So where is it in your budget to say, I mean, I think we should be building it tomorrow, but say the jail doesn't get built for a year out.
We got quotes going out.
Yeah, we've got.
Okay.
So
where is that in this?
that's not in this.
That's not in this because it would.
That's going to be a separate
Facilities budget.
exploration based on what comes back from the new.
So then that would be part of what budget? Where does that go?
Facilities.
Facilities.
General fund.
Uh-huh.
Like,
Okay, all right, into the facilities, which we should be doing pretty quickly, right?
well, we.
We're waiting for the quotes to come back.
So I have
Or do
to
you mean-
pray every day, every night for how long?
Well, they've managed the situation effectively.
No, physically.
I think we're doing.
So do you have an alarm?
You don't need one. You got fire guards, man. I used to be a fire guard.
Everybody in the military was a fire.
That's right, a fire guard, man. Stand there at the,
Yeah, I remember.
yeah, the end of the barracks with your flashlight.
I
Just
don't know
stand
what
there
the
and.
security features are, and maybe that's not something we want to discuss.
No, but I mean, so the alarm goes off, all the doors open.
I
No.
don't know anything.
Well, you know what I'm saying, you don't have to go and manually open the ones, there's an alarm that goes off. You
You'll
have
get
to
into
go.
procedures that probably should be discussed someplace else.
So
Yeah.
I'm just curious, because, I mean, I think that this is an issue.
Oh, it is.
A long
It is,
time,
and that's why.
and I pray every night that nobody gets hurt.
Me too.
That's why I'm talking, because I like to know, because people ask me, and I like to know that we are on top of it.
Right.
So when you find these things out, when you know this, please let me know.
Mr. Crosby, got any other additional on this?
No.
Okay, all right. Any last comments?
No, thank you,
Okay.
guys.
We appreciate it. And then Commander, no, good, thank you guys. We do need to, me, you and Phil and somebody from Chin, one of our architect dudes need to sit down. And
I
then,
don't want to touch you guys about yet.
yeah.
Incredible. You'll like it.
Yeah.
You guys will like Yavapai. And there's good state money reimbursed that.
Yeah, everybody I've talked to said there's so much additional revenue that's available if you go with a separate facility. And I don't know why we haven't done that yet.
We have preached for 13 years trying to get.
We're going to try.
We're gonna do
All right.
it.
Well, with that, appreciate you guys coming in and getting us up to speed, and we'll be getting back with you and chatting with your budget folks on some stuff and just getting some more information, but I appreciate your time.
Thank you.
Any other- All right, the next meeting, yep, sorry. That will be the county attorney's budget this afternoon at 1 p.m. So we'll be back here at 1. Right now, we're adjourned.